Just to avoid any problem, I'm not the general director. I am scientific director, deputy to the general director, which is a bit different. Thank you very much. I'm very pleased and a bit. I have a bit of emotion to have been invited to this conference. Of course, I've been quite a lot within the escaide and also happy at ECDC and all those things all along my professional life, and particularly in infectious disease. But now I have a broader. The job that pay me oblige me to look at a wider scope than infectious disease. So I will try to go to speak from there. So I have no conflict of interest. I just mentioned that I am a member of the ECDC, which is a great place to discuss and to disagree sometimes as well, and also give sound advice to ECDCs that tend to follow us. It's not because Andrea is there, but I think it's, so I enjoyed very much that and learned a lot from that. And also I am the Secretary General of the International Association of National Public Health Institutes, for which the annual meeting will be held next week, so in Addis Ababa. So, yes. So that was a question that were raised by the session organizers. Identify emergent knowledge gaps with relevant speed to support research agenda setting, option mechanism for research prioritization, and challenge of matching the pace of research with rapid needs. And since I am a good pupil, I've tried to use those three questions to structure my presentation. But I will discuss not all, a few of those. Just the outline of my presentation, I'll speak a bit of Santé Publique France, a few words of public health research in France, but just a few, and I will get into priorities. I have made a question mark, what should be priorities? Option and mechanism to implement research gap filling and challenges, and a few concluding remarks. So Santé Publique France is the French National Public Health Agency. It was created in 2015 by merging four public organizations. We had the same, in fact, way of doing that did PHE, but PHE, I think, merged 160 or something organizations. So that was just to make, it's always good to make comparison with other people, with other countries. The job is very much about scientific evidence and expertise for policy and decision in public health. So the target is the population, the target are the citizens and the politicians and decision makers. So we have basically three generic activities: public health surveillance, which is disease, health determinant, risky behaviors, environmental surveillance, and all of those things. That's a lot. Health protection, which deal with detecting, investigating, alerting, preparedness and response. We are very much involved in preparedness and response because we manage the stockpiling, and also we manage medical reserves to be able to respond in case of need. And also we do a lot, and we spend a lot of our energy and resources and money on health improvement through prevention, health promotion, and health education. So we have a national center, and one of the important things is we have one regional unit in each of the regions in France, including overseas territories. And in terms of priorities, the priority in overseas territory, I won't get into that, but may be quite different from those at the metropolitan France metropolitan, so it's something to figure. Maybe it's something that could be discussed, and also overseas territory are within regional context, which you need to take into account. We don't have any mandate for research, and we shall not. And the Ministry of Budget look very closely if we are not using our money to do research. But we do a lot of studies, field study, investigation, and we also produce knowledge, although we are not called research organization. So research in France, just a couple of words. We have research organization and universities, and they bridge together to structure a mixed research unit or centers. We have a national agency for research that fund all the research in all the fields in France, including health research. And we have research alliance that coordinate research organisms for specific team and for life science and health, which include a very teeny public health aspect, deal with life science and health. And the issue is that there is almost no, it's mostly targeted at basic and biomedical research, clinical research, and there is no formal funding for applied research, which I will come to it, and no a priori funding mechanism for research in case of emergency. So if you have an emergency, you need knowledge, you need to think about it in advance in your own institution. And we have been attempting to structure a mixed structure to fund public health research from those who need knowledge to do public health, but it has not been a very good success. It is the Institut de Recherche en Santé Publique. So within that context, for a national public health institute, a national public health agency, the main issue is, and it has been nicely said, and you have said that very nicely, it's applied or operational research, which I'm not sure that there is a very clear definition of that. It's to produce scientific knowledge that aims to provide evidence for direct transfer to health policies, decisions, and public health problem solving. So it's oriented to try to help based on evidence, the best evidence that we have at that time to solve those problems. And so it's need to be done in peacetime, but also in emergency situation, epidemic, acute environmental exposure, disasters. And I will mention a couple of examples of acute environmental exposure. And it should be based on our own, the national public, you need to invest, although Santé Publique France has no mandate and should not spend money on research, we have to find ways in funding some of those activities that are necessary to take action and that are not called research by the research world, at least in France, because it's, as a country, may be more flexible, and also based on an operational partnership with research and academic structures, which for organization and institutional reason are not always easy, and sometimes it can be difficult to set up. So you mentioned what priorities. I don't know exactly, but I would say that I have my own priorities, but what are the priorities from an institutional point of view? I think it's a very, very difficult question to answer. So for a public health agency, it should match with its own strategy and priority linked to the national public health strategy. In France, we have the luck now, in the last few years, we have a public health strategy that has been defined 3 or 4 years ago. So it's very important. Although we sometimes may disagree with some of it, it's very good because it can be used to structure what are your priorities. But those priorities change over time. They change also with the Ministry of Health. You know, one Ministry of Health may be interested in whatever. Another one is interested in something else. Another one may be interested in reducing alcohol consumption. Another one, you know, so you have to adjust to that. But you have to find ways to maintain your priority even if the ministry does not share all of those priorities for political reasons. And some of the current priorities of Santé Publique France, which are cross-cutting, environmental determinants of health and climate change. I think this is one of the most pressing one, because there is a very strong social demand, social request on that, and without and if we follow the social request, we will be doing things that have no sense. So we need evidence on that, and the evidence is lacking for many things on environmental determinant. Effectiveness of preventive intervention. For an agency that work a lot on prevention and health promotion, we need strong evidence of intervention before deploying them. Vaccine hesitancy, which is a huge problem in France. Antibiotic resistance, of course. Large database and data science. We have access to healthcare delivery database, which is 100% coverage of French citizens, and we need a better tool to analyze and to produce evidence from those databases. So data science is a very important thing. Citizen participatory approaches, I think it's something very, very important that we are trying to move into it. It's difficult, but we absolutely need to deal with that. Social and territorial health inequities, and also the economy of prevention. What is the return on investment in investing in reducing alcohol consumption in France, for example? I think we need those things. We are not good at that in France. In the UK, we have been doing quite a lot, and particularly at PHE. But this is one of the orientations that we'd like to move on. So what are the option and mechanism? But I've said it already, plan and commit among the resources that you are planning for your own organization to plan capacity and money and resources to do things that are part of the activity of a National Public Health Institute. For example, survey capacity, being able to do regularly behavioral risk factor surveys, to do a survey with health examination, which is about 20 million investment for about 10 years. And you need to secure that. If you don't secure that, you won't be delivering things that are based on evidence and needs. We should have those data from all territories, including overseas territory, and which is one of the difficulties, and the cost increased very much with getting into more focused area where the context is very specific, context specific with regard to environment, climate, and also to the culture and to social context. Strong network of national reference laboratory. I think this is very important to maintain into that, and we spend about 9 million euro every year on that, and registries and many as a tool to collect information. To have a sustainable surveillance laboratory and investigation capacity, I think it's crucial. If you have an emergency, we do have emergencies or emergence in Western Europe. If you are not able to deploy a team to do the investigation properly with appropriate method, you won't be doing what you are supposed to do and influence on the right influence policies. Environmental exposures and disasters, this is a major issue. I will show an example. And also, of course, you need to work with research team on priority issues, modeling, data science, research in prevention, large cohort studies, exchange of personnel. We try to do that, to have researchers that come to our place, and also having people that work with research unit and funding. We do fund PhD students, which is a nice and effective way and not too costly way of producing knowledge. And participate in call for tenders as well, in association with research team. We have for example, in modeling, we have very good relationship with a couple of teams in France, and this is very effective. If something we start right away to work with them, and there is no money at the beginning to do that, because they have PhD students. We commit some time of our people. We transfer them the data that they need, and they try to assess questions that we are asking in terms of policy and response and influence on decision. The European perspective, I think, is very, very important. We have to have influence the planning process at the planning process at the EU level from any way possible. We shall not, as a public health institute, miss opportunity. But I have to recognize that we, at Santé Publique France, we have not done a very good job. We could do a much better job in participating in EU projects by defining few strategic priorities in which investing some time of our staff, because human resources has been declining and it's continuing to decline at Santé Publique France next year. It's a tragedy. With less people, you cannot do more. If you want to do at the same time health protection and health improvement, you need to commit resources. So we need to secure a bit of person time resources to participate and compete at the European level, and we shall make it as a positive way for staff people. And also we need to train and administer support of scientific staff. And there are examples. I think the vaccine effectiveness initiative I Move Plus has been very useful and very successful. And I think it's important to maintain those tools at the EU level in any way possible. I think in environmental health, we have been participating in HBIME, health biomonitoring of environment pollutants, which is quite a specific thing to do, and we have done big survey on that, and it's very important to participate in this project in terms of sharing experience and also innovation. And also there are incoming H2020, and I think the call on vaccine hesitancy, something that we have pushed very much to participate in France. And there are a couple of projects being set up, but I think it's important, and we have a great need, a big need on that. So how do you match the pace of research with rapid need? I mean, it's in health protection, in an agency like mine, it's an almost day-to-day challenge. What will be the size of the dengue epidemic in 2019 in La Réunion? The Ministry of Health keep on asking that. And so we have worked with Simon Cauchemez at the Institut Pasteur, and we proposed through modeling option, and it turns out that it was appropriate. It was what was predicted was about what happened. But sometime I remember having a PhD student, and we predicted that the outbreak of dengue in French Guiana would occur in 2016, and there have not been a dengue epidemic. Also, the model was very good and was published in PLOS Neglected Infectious Disease. So we have to be careful on those. How important was the autochthonous transmission of Zika in an area of Aedes albopictus implantation this summer in Le Var, France? The survey has been done, but you need to commit people to be able to do that. Do we have cases of pneumonia related to e-cigarette? Do we have? We have 4 so far in France, 4, 1 coming from the US. What are the short, mid, and long-term effects of an industrial disaster? And so this is in health protection, but we need also to fill many knowledge gaps. Yeah, I have a couple of more slides. For prevention priorities, what are the effectiveness of an intervention that has been evaluated positively elsewhere? Does it work in the French context? In which intervention investing to reduce vaccine hesitancy? Wow. We need also preparedness plans to mobilize timely field studies and applied research. We need to be prepared for infectious disease, but as much and even more for emergency and environmental risk. We have been, we have had to plan surveys and court study following terrorist attacks, for example, and this has been extremely useful in producing evidence for which there was no evidence in how to prevent post-traumatic syndrome, for example. That's one example. That And very recently, just to make a concrete example, we had a toxic cloud following a fire of an industrial plant in Rouen, and you see the modeling of the cloud, and which even went into Belgium. And so it was a major crisis, and we had to assess short-term health effect impact. Also, what is the mid-term impact on mental health and quality of life? We are implementing a survey, population survey on that. Assess pollutant biomarkers, because maybe there were dioxin products that were released, and what are the long-term exposure, the long-term effect for risk, and also you cannot do that, this kind of research, this kind of studies, I should not say research, studies, but contribute to the feeling of the knowledge gap without participation of the citizens. And another thing, don't miss opportunities. And at the National Public Health Institute, we have data, we have outbreaks, we have so many opportunities. And as it had been said just before, I think you can do a lot, you can produce good knowledge by using those data and using students and PhDs. And there are many examples that you can invest in that. And also, and outbreaks are great for that. And also, it allows publication of useful data for others that do the same job in other places. So I think it's something that should not be overlooked. And in terms of concluding remarks, I mean, besides the applied dimension, we need a public health research ambitious that should be done at the national and European level. It's a question of money, but not only. It's also a question of research human capacity and structure to be developed. Without researcher in public health, you won't, if you have money, you won't have good project. So I think it's very important to do that. It takes time to build solid evidence. One study can show that something, and it can be dismantled by other studies. So we have to keep that in mind. Advocacy at national and global levels. Further study, we always say, well, we need more research to act. There are many issues on which you can act without new knowledge. Many issues, and particularly when it comes to political issues. For example, we had prepared a dry January, this January, next January. It is based on evidence. It works. It has been in elsewhere, but at the highest level of the country, it was felt that it was not appropriate. Because, we have a wine industry, as you know that. I may be fired when I go back to France. And also, I have a last question, which role of the industry in applied research to drive policy. I think it's a huge question, and I don't think we have gone through that properly yet, and because also the citizens, they say, well, you do that because you want to make a market for the industry, and this is for vaccine, but also for chronic diseases, NCDs, and other things. Thank you very much.